If you can stand up from a chair right now, without using your hands, without rocking back and forth, without pushing on anything, I need you to remember that feeling. Because in the next 10 minutes, I am going to show you why doctors quietly use that exact movement to predict how long someone might live. Sounds not walking, not running, just standing up from a chair. And before you click away thinking this sounds too simple to matter, let me tell you, this short video could be the reason you never need someone's arm to help you stand up again. Stay with me till the end, because what I am about to show you in the next few minutes is something most videos on this topic get completely wrong. There is a simple test that physical therapists use. I want to start by telling you something doctors already know, but most people never hear. There is a simple test that physical therapists use all over the world to check how strong an older adult really is. It is called the sit-to-stand test. In 30 seconds. You sit in a chair, you cross your arms over your chest, then you stand up and sit down as many times as you can in 30 seconds. That is it. No machines, no blood tests, just standing up and sitting down. This simple test is connected. But here is the part that should grab your attention. Researchers have found that how well a person does on this simple test is connected to how healthy their heart is, how strong their legs are, and even how long they may live. Clinics across America. This is not something I am saying to scare you. This is something real physical therapists use every single day in clinics across America as part of a national program from the CDC called Steady Eye, which stands for Stopping Elderly Accidents, Stopping Falls in Older Adults, and Injuries. And one of the main tools for a second. The government built an entire program around stopping falls in older adults, and one of the main tools they use is this same simple chair stand. Now here is why this matters so much more than people realize in this next part. Please do not skip, but forget that. As we get older, our body quietly starts losing muscle. Doctors call this sarcopenia, but forget that big word. Just think of it like this. Your legs are like the foundation of a house. When you are young, the foundation is strong without you even trying. But after 50, 60, 70 years old, the foundation starts to weaken a little every year, especially if you are sitting on a soft couch, or the day you do not feel it happening slowly. You feel it suddenly, the day you struggle to get up from a soft couch, or the day you need to push off the armrest just to stand up from the dinner table. That moment is not just getting old. That moment is your body sending you a warning sign. It is telling you that your leg muscles, the same muscles that keep you balanced and keep you from falling, are getting weaker. And weak legs are one of the biggest reasons seniors fall. Falls are one of the most common causes of serious injury in adults over 65 in the United States. This is not me trying to frighten you. This is simply true, and the CDC has built whole safety programs because of it. And it does not telling you this to make you afraid. I am telling you this because there is something simple you can do about it. And it does not involve gyms, it does not involve fancy equipment, and it does not require you to go for long walks if your knees or your hips do not allow that right now. The heart of the whole video. That something is the chair stand exercise. And I want you to really listen here, because this is the heart of the whole video, the part everything else builds on. The chair stand exercise is simply this. Forward. You sit on the edge of a sturdy chair, feet flat on the floor, about shoulder width apart. You lean your chest slightly forward. You push through your heels, and you stand all the way up, nice and slow. Then you control your body back down into the chair. That is one repetition. You do slow and steady, like you are gently lowering yourself rather than just plopping down. That is one repetition. You do not need to rush. You do not need to do 20 in a row on your first day. Even 5 slow, controlled chair stands done with good form can begin to wake up muscles that have been sleeping for years. That is a fair question. Now you might be asking me, why is this one move so special? Why not just go for a walk instead? That is a fair question, and I want to give you an honest answer, because I promised you no exaggeration in this video, only truth. Walking is wonderful for your heart and for your mood. No one is telling you to stop walking if you enjoy it. The chair stand doctor has cleared you for it. But walking mainly works your heart and your endurance. The chair stand works something different, and for many older adults, something even more urgent, which is raw leg strength and the ability to go from sitting to standing safely. This single movement, standing up from a seated position, is something you do dozens of times a day. Getting out of bed, getting up from the toilet, getting out of the car, getting up from a chair at a restaurant. If that movement becomes hard, your whole world gets smaller. People begin avoiding outings. They begin asking others for help with simple things. You are training your independence. They begin feeling less independent. So when you train the chair stand, you are not just training a muscle, you are training your independence. You are training your ability to keep living your life exactly the way you want to, without needing someone else's arm to lean on. Stay with me. This next part is the science made so simple, even a 5-year-old could understand it. Inside your thighs, you have big muscles called the quadriceps. The engine is strong, and in the back, the car starts easily, drives glutes. These muscles are like the engine of a car. When that engine is strong, the car starts easily, drives smoothly, and stops safely. When that engine gets weak, everything becomes harder, the car struggles to start, it stalls, and sometimes it does not stop in time. Your legs work the exact same way. When those muscles are weak, muscles are strong, standing up is smooth, and stopping yourself from a stumble is much easier. When those muscles are weak, every stand-up becomes a struggle, and every uneven step becomes a risk. The chair stand exercise directly trains a signal to your body that says every single time you push yourself up from that chair, slowly and with control, you are sending a signal to your body that says, we still need this muscle, keep it strong. And your body listens. Muscle responds to use. This is not a miracle. This is simply how the human body has worked since we were young. And research on resistance training in older adults backs this up again and again, showing that even simple strength exercises like this can help maintain muscle and bone health well into your 70s, 80s, and beyond. I understand that feeling. I know what some of you may be thinking right now. This sounds too simple to actually work. I understand that feeling because we are told that good health needs to be complicated, expensive, or exhausting. But real evidence-based medicine often points to the opposite. The CDC Physical Activity Guidelines for adults over 65 recommend a mix of activities, including muscle strengthening exercises at least 2 days a week, alongside aerobic activity like walking. The chair stand fits perfectly into that muscle strengthening category. And the beautiful part is, you can do it without leaving your living room, without buying equipment, and without worrying about painful impact on your knees the way running or jumping might cause. And I promise you, this story is not over yet. Let me tell you a story, because I think it will help this stick in your heart, not just your head. And I promise you, this story is not over yet, so keep watching. Picture a woman, let us call her Linda, 72 years old. For the last year, every time she stood up from her favorite armchair, she had to push hard on the armrest. She stopped inviting friends over because she did not want them to see her husband to help pull her up. She started to feel embarrassed. She stopped inviting friends over because she did not want them to see her struggle. She started believing this was just what getting old looked like, and there was nothing she could do about it. One day, her granddaughter showed her a few slow chair stands, just like the ones I described to you a few minutes ago. Some days Linda started with 3. The next week, 5. She did not do it perfectly. Some days she skipped it entirely. But slowly, over a few months, something changed. Standing up from that armchair stopped needing 2 hands on the armrest. She did not run in one hand, then barely a touch, then nothing at all. Linda did not become an athlete. She did not run a marathon. She simply got her independence back, one small movement at a time. I am not telling you this story to promise you the exact same result that changes, because every single body is different, and some of you may have arthritis, joint replacements, or other health conditions that change what is possible for you. That is exactly why I want you to talk to your own doctor before starting any new exercise. I'm telling you Linda's story because it shows you especially if you have a heart condition, recent surgery, or severe joint pain. But I am telling you Linda's story because it shows you something true. Small, consistent movement, done safely, can change daily life in a real and meaningful way. I can give you this today. Next part is something most videos on this topic never tell you. The biggest danger with the chair stand exercise is not the exercise itself. I can give you today. It is doing it the wrong way. The biggest danger with the chair stand exercise is not the exercise soft and low like a couch. It is doing it the wrong way. The chair can slide, or if you use a chair with wheels, or a chair that is too soft and low like a couch. Ideally, one with arms nearby just in case you need a light touch for balance. Always
placed
use a
against a
sturdy
wall
chair,
or in a corner where
ideally
it cannot
one with
slide
arms
backward.
nearby, just in
Keep
case
your
you
feet
need a
flat
light
on the
touch
ground
for
the whole
balance,
time,
not
placed
tucked under
against
the
a
chair.
wall or in a
Move
corner
slowly,
where it cannot slide
especially on the
backward.
way down.
Keep your
because
feet
the slow
flat on the
controlled
ground the
lowering
whole
is just
time,
as
not
important
tucked
for
under the
building
chair.
strength as the
Move
standing
slowly,
up part.
especially
If you
on the
ever
way
feel
down,
dizzy,
because
short
the
of
slow
breath in a way
controlled
that feels
lowering is
wrong,
just as important
or
for
sharp
building
pain in your
strength
knees or
as the
hips,
standing up part.
stop right
If
away
you ever feel
and
dizzy,
check with your
short of
doctor
breath
before
in a way that
continuing.
feels wrong,
This exercise
or
is
sharp
meant to
pain in
help
your knees
you,
or hips,
never to hurt you.
stop right away.
And listening to
and
your
check
own
with your
body
doctor
is always
before
more
continuing.
important than finishing a
This
certain
exercise
number of
is meant to
repetitions.
help you. I
Never
also
to
want to
hurt
be
you.
completely honest
And
with you
listening to
about
your own
something,
body is
because
always
the
more
next thing I
important
tell
than
you
finishing
might
a
surprise
certain
you.
number of repetitions.
This one chair exercise
I also
is
want to be
powerful,
completely honest
but
with
it
you
is
about
not magic,
something.
because
And
the
no
next thing I
exercise
tell
on
you
earth
might
can
surprise
promise
you.
to cure a
This
disease
one
or
chair
guarantee you will
exercise is
never fall
powerful,
again.
but it is
What
not
the
magic,
research does show
and no
is
exercise
that
on
stronger
earth can
leg
promise
muscles
to cure a disease
and better
or guarantee
functional
you will
movement
never fall
are
again.
connected to lower fall
What the
risk,
research does
better
show
independence
is that
in daily
stronger
life
leg
for many
muscles
older adults
and better
that
functional
is a
movement
meaningful
are connected
evidence-based
to lower
reason to
fall
start.
risk and better
But I will
independence
never
in
stand
daily
here and
life
tell
for
you
many
this single
older
movement
adults.
will fix
That
everything
is a
on its own.
meaningful
The
evidence-based
most
reason
honest
to
path
start.
forward usually
But I
combines
will
a
never
few
stand
simple
here and
habits
tell you
together.
the single
Gentle
movement will
strength
fix
work, like
everything
the
on
chair
its own.
stand.
The
Some
most
walking
honest
if your
path
body
forward
allows
usually
it.
combines a few
Good
simple
hydration
habits together,
enough protein
gentle
in your
strength
meals
work,
to
like the
support
chair
your muscles,
stand,
and
some
regular
walking if your
checkups
body
with your
allows
doctor,
it,
especially
good
if you are
hydration,
managing things like
enough
high blood
protein in
pressure,
your meals to support your
diabetes,
muscles,
or joint issues.
and regular checkups
Real health
with your
is rarely
doctor,
about
especially
one
if
single
you are
secret.
managing things like
It
high
is about
blood
a
pressure,
few honest habits,
diabetes, or
repeated
joint
with
issues.
patience. Real
Now
health
let
is
us talk
rarely
about
about
how
one
to
single
actually
secret.
build this into your life.
It is about a few
in a way
honest
that
habits,
feels realistic,
repeated with
not
patience.
overwhelming. Now let
And
us
this
talk
part
about
might be
how
the
to
most
actually
useful
build
thing
this
you
into
hear
your
all day.
life. You do
In
not
a way
need
that
to
feels
set aside a whole
realistic,
hour.
not
You
overwhelming.
do not need special
And this
clothes.
part might be the most
Here is a
useful
simple
thing
way
you hear
many
all day.
seniors start.
You do not need
in
to
the
set
morning,
aside a
right
whole
after
hour.
you wake up.
You do
and
not
before
need
you
special
even check
clothes.
your phone.
Here is a
Sit on
simple
the
way
edge of
many
your bed
seniors
or a
start.
sturdy chair
In the
nearby,
morning, right
and
after
do
you
just
wake
3
up
to 5
and
slow
before you
chair
even
stands.
check your phone.
That is it
Sit
for
on
the
the edge
morning.
of your bed
Later
or a
in
sturdy
the day,
chair nearby.
maybe after lunch,
and do just
do
3
another
to 5
small
slow
set.
chair stands.
Again, just whatever
that
feels
is it
manageable.
for the morning.
Even if that is
Later
only
in the
2 or
day,
3,
maybe after
in
lunch,
the evening, do
before
another
dinner,
small set.
One
Again,
more
just
small
whatever
set.
feels manageable.
You are not aiming for
even
a
if that is
perfect
only
number
2
on
or
day
3.
one.
In the
You are
evening,
simply
before
teaching
dinner,
your body the
one
pattern
more
of standing
small
up
set.
with control.
You are not aiming
multiple
for a
times a
perfect
day
number on day
in
one.
small doses that
You
do
are
not
simply
exhaust
teaching
you.
your body the
Over the
pattern of
weeks,
standing
you
up
may
with
naturally
control,
find yourself
multiple
able to
times
do
a day,
more repetitions
in small doses
hold
that
better
do not
balance,
exhaust you,
or feel less
Over
out
the
of
weeks,
breath afterward.
You may naturally
Progress
find yourself
with this kind
able
of
to do
exercise
more
is
repetitions,
usually slow and
hold
steady,
better balance,
not overnight,
or feel less out of
and
breath
that slowness
afterward.
is actually
Progress
a sign
with
that
this
it is
kind of
working the right
exercise
way.
is usually
building
slow and
real
steady,
strength
not
rather
overnight,
than just temporary
and that
soreness.
slowness is actually
I
a
also
sign
want to
that
gently
it is
mention
working
something
the right
many
way.
people overlook.
Building real
which is
strength
breathing.
rather than just temporary
As you stand
soreness.
up,
Breathe out
I also want to
slowly
gently
through your
mention
mouth,
something many
like you are
people
blowing
overlook,
out a candle,
which is breathing.
As you lower back down,
As you stand
breathe
up,
in through your nose.
breathe out slowly
This
through your
simple
mouth,
breathing pattern
like
can
you
help
are
you
blowing
avoid
out a
holding
candle,
your breath. As you
which
lower back
sometimes
down,
causes a
breathe
brief
in
spike
through your
in blood
nose.
pressure or
This
lightheadedness,
simple breathing pattern
especially
can help
in
you
older
avoid
adults.
holding your breath. It is a small
sometimes
detail, but
causes a
small
brief spike
details
in
are
blood
often
pressure
what
or
separate a
lightheadedness,
safe exercise
especially in
routine
older
from an
adults.
unsafe one.
If
It
you
is
are
a small
someone who
detail
currently
but
cannot
small
stand up at
details
all
are
without
often
using your
what
hands,
separate a safe
please do not feel
exercise routine
discouraged
from an
and
unsafe
please
one.
do not feel like
If you
this
are
video
someone who
does not
currently
apply to
cannot
you.
stand up
You
at
can
all without
absolutely
using your
start by
hands,
using your hands
please
on
do
the
not feel
armrests for
discouraged,
support, and please do not
focusing
feel like
simply
this
on
video
slow,
does not
controlled
apply to
movement
you.
rather
You can
than speed.
absolutely start by
Over
using your
time,
hands
as
on
those
the
muscles
armrests for
slowly
support,
strengthen, many people
focusing
find
simply
they
on
need
slow,
less and less
controlled
support
movement
from
rather
their
than
hands.
speed.
This is not
Over
a competition,
time, as those
and there is
muscles
no
slowly
shame in
strengthen,
starting
many wherever
people
your
find
body
they need
currently
less
is.
and less support
The only
from their
real
hands.
failure here
This is
would
not
be
a
not starting
competition,
at all
and
out
there
of
is no
fear or
shame in starting
embarrassment
wherever your
I
body
want you to
currently
think about
is.
your future for
The
a
only
moment.
real failure
Not
here
in a
would be
scary
not
way, but
starting
in a
at all
hopeful
out of
one.
fear or embarrassment. Imagine being able to
I want
play
you
with
to
your
think about your
grandchildren on the
future for a
floor
moment.
and getting back
Not
up
in a
without
scary
help.
way, but in a hopeful way.
Imagine getting out of the car
Imagine
after
being
a long
able to play
drive
with your
without that
grandchildren
familiar
on the
ache and
floor
struggle and getting back up
Imagine
without
walking
help.
into a family gathering.
Imagine getting out of the
standing
car
tall,
after a
moving
long
with
drive without
confidence,
that familiar
instead
ache
of
and
worrying
struggle.
about whether your legs
Imagine
will hold
walking
you
into
steady.
a family gathering.
None of this requires
standing
you to
tall,
become a
moving with
bodybuilder or a
confidence,
marathon runner.
instead of worrying
It simply
about whether
requires
your legs will hold
consistency
you
with a
steady.
movement as
None of
simple
this
as standing
requires
up
you to
and
become a
sitting down,
bodybuilder
done with
or a
intention.
marathon runner a few
It
times a
simply
day,
requires
starting
consistency
today.
with a movement.
Before we
as
close,
simple
I
as
want to
standing
remind
up
you of
and
something
sitting
important
down,
because
done
your
with
safety
intention.
always comes
a few
first
times
to
a
me.
day,
starting
If
today.
you have any heart condition,
Before we close, I want to
a recent
remind you of something
surgery, severe
important because your
osteoporosis,
safety always comes
uncontrolled
first
high
to
blood
me.
pressure,
If you have any
or
heart
condition
condition your doctor is currently
recent
monitoring,
surgery, severe
please talk to them
osteoporosis,
before starting this or
uncontrolled
any new
high blood
exercise
pressure,
routine.
or any condition your
sharing
doctor is
real
currently
evidence-informed
monitoring,
information
please
with
talk
you
to them before
because
starting
I care
this or
about
any
you and
new
your family.
exercise routine. But I am not able
I
to
am
see your
sharing
medical
real
history
evidence-informed
and your own
information
doctor
with
knows
you
your body far
because I
better
care
than
about
any
you and
video
your
ever
family.
could. But I am
Use
not
this
able to see your
information
medical
as a starting
history
point for that
and your own doctor
conversation,
knows your
not
body
as a
far better than
replacement
any
for it.
video ever could.
If this video helped you
Use this
understand
information
something new
as a
about your
starting
own
point
body
for that
today,
conversation,
that genuinely
not as a
means
replacement
lot to
for
me,
it.
because that is
If this
exactly
video
why I
helped
make
you
these
understand
videos.
something new
If
about
you are
your
going
own
to
body
try this
today,
chair stand
that
exercise,
genuinely means a lot to
even
me,
just 3
because that
slow
is exactly
repetitions
why I
today,
make these videos.
I want you to comment
If you are
below and
going
tell
to
me
try
I
this
will
chair
check my
stand
chair
exercise,
today.
so I know
Even
you are
just
taking
3
this
slow
small step for
repetitions
yourself.
today.
Please
I want
like
you to
this
comment
video
below
so
and
it
tell me
reaches
I
more
will check
seniors
my
and
chair
families
today,
who need to hear
so
this
I know you
honest
are taking this
information
small
instead
step
of
for yourself.
exaggerated promises.
Please like this video
Subscribe
so
to
it
this
reaches
channel
more
because I am
seniors and
committed
families
to
who
bringing
need to
you
hear this
real,
honest
simple,
information instead of
doctor-informed
exaggerated
guidance,
promises.
not scare
Subscribe
tactics,
to this channel
and not
because I am
miracle
committed
cures.
to bringing
And if
you
you found
real,
this video
simple,
valuable,
doctor-informed
in the
health
next video,
guidance, I am
not
going
scare
to show you the
tactics,
warning
and
signs
not
your
miracle
balance may be
cures.
giving you
And
right
if you
now.
found this video
Signs that
valuable,
most people
in the
brush
next
off
video,
as just
I am
clumsiness,
going to show you
but
the
which
warning
doctors
signs your
actually
balance
pay
may be
close
giving
attention
you right
to.
now.
You will
Signs
not
that
want to
most
miss
people
that
brush
one.
off as just
Take care of
clumsiness,
yourself,
but
take
which
care of your
doctors
legs,
actually
and
pay
I will
close
see you in
attention
the
to.
next video. You will not want to miss that one. Take care of yourself, take care of your legs, and I will see you in the next video.